And now to our sponsored segment, Ask the Expert. Dr. Kevin Rose from the Rose Clinic joins us now. Okay, so you brought some props for us that pretty much explain what we're talking about today.
Exactly. So if you talk to 100 women in the last couple of years who have had augmentation, they're going to tell you that they probably have had a smooth, round silicone implant. So
is this one of them?
Yeah, this is an example of it. So it has a smooth shell, and when you put it in, the implant will just naturally kind of move around a little bit. So when we put one of these in, we actually purposely make the space a little bit bigger than the implant.
Okay.
So the implant can move around a little bit, and the theory is that having a slightly bigger space will decrease the risk of having scar tissue form around the implant.
Got it. So you don't get that hard feeling, it feels more natural.
Right. And so that's called capsular contracture. Well, there's a new implant on the market now, which has a textured surface. So if you were to feel this, it kind of feels almost kind of like Velcro a little bit, not quite that rough. Maybe the smooth part of Velcro.
Yeah, but definitely a lot different than this one.
And so what this does, it almost acts like an internal bra when it's inside. And so what we do is we make the pocket smaller so it just barely fits in. And we don't have the patient massage the implants or anything like that. And then what happens is that the tissue actually kind of sticks to the surface of the implant, and that decreases the risk of implant displacement.
Okay.
It also decreases the risk of having the scar tissue form around the implant.
So for a woman, let's say you know, you're trying to convince me which one I should get. Which one is a better option for a woman who's thinking about augmentation but doesn't know which one to go with?
Well, we take into consideration a lot of different things. So if a patient is very active and they want kind of a natural appearance, and they don't really want sort of an over kind of augmented type of an appearance, then the textured implant is great, because what it does is it creates kind of almost like a unified breast reconstruction where you have a hard time telling where the implant is. When a smooth one is inside, you actually can move the implant around and you can kind of see where the implant moves. You can see it, so you always know where the implant is.
So
you always know where the breast is.
Yeah.
But this creates more of a unified reconstruction, which is really nice.
Is it easier for you as a surgeon, or is it?
It's not necessarily. It's actually a little bit more. It's a little bit more difficult. It's not quite as easy to manipulate post-operatively. So if you don't get it perfect on the table, if one implant is a little higher, it has a tendency to want to stay higher. So it's my job to do a good job.
That's why we pay you the big bucks at Rose Clinic. Okay, so if someone wants to learn more information, because this is relatively new, how can they find out more?
Well, you can go onto my website, theroseclinic.com, or give us a call. Consults are free, and it's what I do most often, is breast augmentation. Is
there anyone who you wouldn't recommend this new implant for?
Just anybody that kind of wants a very over full kind of augmented appearance, because for right now there are limited sizes with what we can do with this implant.
So if you're looking to be Pam Anderson, you want to go with the more traditional style, but if you have, like you said, an active lifestyle, or you want it to look a little bit more natural, maybe this is the go for you.
That's right.
Awesome. Dr. Kevin Rose, thanks for joining us.
Thank you so much.
We'll put that information on our website at goodforutah.com.